Brachial plexus. By Professor Saeed Makarem. Functions of the nerves of the upper limb. Sensory innervation to the skin and joints. Motor innervation to the muscles. Control the diameter of blood vessels via sympathetic vasomotor nerves. 4. Sympathetic secretomotor supply to the sweat glands. What is a brachial plexus? Brachial plexus is a network of nerves present at the root of the neck to enter the upper limb. Location and formation. Brachial plexus is present in the posterior triangle of the neck and axilla. It is formed by the union of the anterior brachii of the C5th, 6th, 7th and 8th and the first thoracic spinal nerve. Formation. The plexus can be divided into 5 stages, 1 stage of roots, 2 stage of trunks, 3 stage of divisions, 4 stage of cords, 5 stage of branches. Roots. In the posterior trunks, in the posterior. Formation. The plexus can be divided into 5 stages. Roots. In the posterior. Trunks. In the posterior. Divisions. Behind the clavicle. Cords. In the axilla. Branches. In the axilla. The first 2 stages lie in the posterior triangle, while the last 2 stages lie in the axilla. The roots of C5 and C6 unite to form upper trunk. The root of C7 continues as the middle trunk. The roots of C8 and T1 unite to form lower trunk. Divisions. Each trunk divides into anterior and posterior divisions where the anterior divisions of the upper and middle trunks unite to form the lateral cord. The anterior division of the lower trunk continues as the medial cord. The posterior divisions of all 3 trunks join to form the posterior cord, axillary sheath. The cords become arranged around the axillary artery in the axilla. Brachial plexus. The axillary artery and the axillary vein are enclosed by a sheath of fascia called axillary sheath. Relation of cords. All 3 cords of the brachial plexus lie above and lateral to the first part of the axillary artery. Relation of cords. Cords are named according to their relation to the second part of the axillary artery. Medial cord crosses behind the artery to reach the medial side of the second part of the axillary artery. Posterior cord lies behind the second part of the artery. Lateral cord lies on the lateral side of the second part of the artery. Branches. The branches of the different parts of the brachial plexus are: eye roots, dorsal scapular nerve, C5, long thoracic nerve, C5, C6 and C7, to upper trunk. The only trunk which gives branches is the upper trunk. It gives 1 nerve to subclavius, C5 and C6. 2 suprascapular nerve, C5 and C6, supplies the supraspinatus and infraspinatus muscles. Lateral cord, 3 cords, lateral pectoral nerve, C5, C6 and C7. Musculocutaneous nerve, C5, C6 and C7. Lateral root of median nerve, C5, C6 and C7. Medial cord, medial pectoral nerve, C8 and T1. Medial cutaneous nerve of the arm, C8 and T1. Medial cutaneous nerve of the forearm, C8 and T1. Medial root of median nerve, C8 and T1. Ulnar nerve, C7, C8 and T1. Posterior cord, upper subscapular nerves, C5 and C6. Lower subscapular nerves, C5 and C6. Axillary nerve, C5 and C6. Thoracodorsal nerve, C6, C7 and C8. Radial nerve, C5, C6, C7, C8 and T1. Branches. An axilla nerve to subclavius, supplies the subclavius muscle. May give contribution, C5, to the phrenic nerve, long thoracic nerve, C5, C6 and C7. Nerve to serratus anterior, or nerve of Bell. Arises from the root. Enters the axilla by passing down over the lateral border of the first rib behind the axillary vessels and brachial plexus. Supplies the serratus anterior muscle. Lateral pectoral nerve. Arises from the lateral cord. Supplies the pectoralis major muscle. Musculocutaneous nerve. Arises from the lateral cord. Supplies the coracobrachialis, brachialis and the biceps brachii muscles. Leaves the axilla by piercing the coracobrachialis muscle. Lateral root of the median nerve. Is a direct continuation of the lateral cord. Is joined by the medial root to form the median nerve trunk. Gives no branch in the axilla. Medial pectoral nerve, arises from the medial cord, supplies and pierces the pectoralis minor muscle, supplies the pectoralis major muscle. Arises from the medial cord, is joined by intercostobrachial nerve. Medial cutaneous nerve of the arm. Arises from the medial cord. Is joined by intercostobrachial nerve. Supplies the skin on the medial side of the arm. Arises from the medial cord, descends in front of the axillary artery. Medial cutaneous nerve of the forearm. Arises from the medial cord. Descends in front of the axillary artery. Ulnar nerve, arises from the medial cord. Descends between axillary artery and vein. Gives no branches in the axilla. Medial root of the median nerve. Arises from the medial cord. Crosses in front of the third part of axillary artery. Joins the lateral root of the median nerve on the lateral side of 1/3 part of axillary artery. Upper and lower subscapular nerves. Arise from the posterior cord. Both supply the subscapularis muscle. The lower subscapular nerve supplies also teres major muscle. Thoracodorsal nerve, arises from the posterior cord. Runs downward to supply the latissimus dorsi muscle. Axillary nerve. Is the smaller of the two terminal branches of posterior cord. It supplies the deltoid and teres minor muscles. Gives branch to the shoulder joint. Divides into anterior and posterior branches. Radial nerve, largest branch of brachial plexus. It is the continuation of the posterior cord, lies behind the axillary artery, supplies all muscles of the back of the upper limb.